Take off your shoes right now. Not after this video, right now. Sleep them off because what I'm about to show you is something your body may have been trying to tell you for months, possibly years.
Here's what makes us different after 60. The same signs that mean nothing at 40 mean something very different at 65. Repair systems are slower. Blood vessels are narrower. The window to catch this early gets smaller every year you wait.
My name is Chloe Lin. I'm a metabolic health expert, and I'm going to show you 9 signs that appear on your feet, often years before any lab result confirms a problem. Some will surprise you. One you've almost certainly dismissed as angry. Don't close this tab.
Sign 1. Tingling or pins and needles. Almost every patient describes this the same way. Foot falls asleep. They shifted position, it passed. Normal.
Here's the question I always ask. Is it happening without a clear reason? When you haven't been sitting awkwardly, when both feet tingle at the same time, when it wakes you up at night.
High blood sugar acts like a slow acid on the protective coating around your nerves. Think of it like plastic insulation on an electrical wire. When it breaks down, signals get fuzzy. That fuzziness is the tingling you feel. This is peripheral neuropathy. It affects nearly 50% of people with diabetes and almost always starts in the feet.
What nobody tells you. A pinched nerve tingles on one side and improves when you change position. Diabetic neuropathy tingles in both feet, starts at the toes, and doesn't care how you sit. That distinction matters.
Daily habit, a 20 to 30 minute walk every morning. Reduce added sugar starting today, not next week, today. Sign 2. Burning feet at night. It's 2 a.m., the room is dark, your feet feel like they're on fire, even though nothing is touching them.
Most people blame tired legs or summer heat, but burning in the soles at night is one of the earliest signs of nerve damage from high blood sugar.
Here's why it gets worse at night. During the day, your brain is flooded with input. The burning is there, it just gets drowned out. At night, that damaged nerve becomes the loudest thing in your world. Think of a broken thermostat sending a heat signal even when the room is perfectly cool. The nerve isn't reading your foot accurately. It's creating a reading that doesn't exist.
Research in diabetes care found the symptom appears 1 to 3 years before formal diagnosis. Years earlier, daily habit, 8 glasses of water, more fiber every meal, vegetables, oats, legumes. Fiber slows sugar absorption. That's exactly what those nerves need.
Sign 3. A wound that won't close. This is where things stop being uncomfortable and start being genuinely dangerous. A blister from a shoe 3 weeks ago, a small cut, still there. Not infected, not worse, just not closing.
When blood sugar stays elevated, tiny blood vessels in the feet narrow and stiffen. Oxygen, white blood cells, repair proteins. They can't reach the wound fast enough. Think of watering a garden with a serious kink in the hose. The water exists. It just can't get where it needs to go.
The CDC reports diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations, over 100,000 every year. Almost all started as something small someone ignored.
Tonight, after your shower, look between every single toe. Check both heels and look at the bottom of the big toe. That's where 60% of diabetic ulcers begin. Anything not improved in 48 hours, call your doctor, not next week. 48 hours. Let me tell you about someone I'll call Robert. 68 years old, retired teacher, worked every day, felt completely fine, came in for a routine visit.
Before any blood work, I asked about his feet. Heels cracking for 2 years, lotion every night, no result. Feet cold sometimes, even in July. His wife told me she had noticed his feet looked different about a year ago. She mentioned it. He said it was nothing. She was right. Fasting glucose, 229. HbA1c, the 3-month average, 8.1. Diabetic for at least 3 years without knowing it.
He looked at me and said, "Why didn't anyone ever show me what to look for?" That is exactly why I made this video. So that question is never yours to ask.
Sign 4. Skin darkening around the ankles. When circulation is compromised, oxygenated blood stops arriving properly and skin changes color, deep red, slightly blue, or simply darker. A study in the Journal of the American Academy of Dermatology found these changes appear 18 months before formal diagnosis.
Look for a ring of discoloration around the ankle bone, like a waterline stain. 5 minutes of ankle circles and calf raises every morning.
Sign 5, cracked heels that don't respond to moisturizer. Diabetes damages the autonomic nerves controlling your sweat glands. When those nerves fail, feet dry from the inside out. No lotion fixes that.
Here's a test. Apply moisturizer every night for 3 consecutive weeks. Still cracking? That is not a skin problem. That is a nerve problem. Tell your doctor those exact words.
Coconut oil or unscented lotion nightly, never between the toes. Sign 6, persistent swelling with sock marks. High blood sugar stresses the kidneys, which control fluid balance. When filtration weakens, fluid pools at the lowest point of your body. The National Kidney Foundation reports diabetic kidney disease affects 1 in 3 adults with diabetes.
The feeding test. Press your thumb into the swollen area for 5 seconds. If the indentation stays, photograph it before your appointment. Elevate your feet above your heart when resting. Cut sodium. We're halfway through, and I need to ask you directly. Have you recognized yourself in any of these signs? Type yes in the comments right now and tell me, what state are you watching from? I read every comment.
If someone you love needs to see this, hit the like button 1 second, and YouTube reaches more people over 60 who need it. Sign 7 is the one most people have been masking with ibuprofen for years without ever understanding why it never worked. Sign 7, stabbing or electric pain in the feet, almost universally misdiagnosed as arthritis. But diabetic nerve pain has a specific quality, arrives without warning, feels like an electric shock, worst at night.
It doesn't respond to ibuprofen because ibuprofen reduces inflammation. It does not fix the misfiring nerve. Those are 2 completely different problems.
If you've taken anti-inflammatories for foot pain for more than 4 weeks with no real improvement, that's the signal. The New England Journal of Medicine found this affects 25% of people with diabetes and is routinely mistaken for arthritis.
5 minutes of gentle foot stretches before getting out of bed each morning.
Sign 8, feet cold all the time. Even in July, there's a difference between running cold and cold regardless of temperature. After 60, this matters more. Your peripheral arteries have already narrowed naturally with age. High blood sugar accelerates that significantly. The American Heart Association links this to peripheral artery disease affecting over 8 million Americans, with diabetes as the single largest risk factor.
Cold feet in your 60s is not the same as cold feet in your 30s. 30 minutes of purposeful walking every day. Start with 10 if 30s feel too far.
Sign 9, hair loss on the lower legs and tops of the feet.
Look at your lower legs right now. This is a sign almost nobody talks about. I have never seen it in a patient brochure.
Hair follicles need steady blood supply. When circulation is impaired, they stop receiving what they need and stop producing hair. Research in diabetes, obesity, and metabolism found this correlates strongly with peripheral vascular disease. Clinicians are specifically trained to look for it, yet patients never mention it because nobody told them it meant anything.
What I'm looking for is change over time. Hair that was there 5 years ago and is now. That's the signal.
9 signs, 9 places your body has been trying to get your attention. Tonight, sit in good light. Look at both feet. Check between every toe. Feel for numbness. Look at your lower legs. 3 minutes.
If you recognize 2 or more signs, call your doctor tomorrow morning. Say these exact words. I've been noticing changes in my feet, and I want a fasting glucose and an HbA1c. Those 2 tests take 10 minutes and tell a far fuller story than 1 number alone.
While you wait, start the habits. Walk every morning. Reduce added sugar, more fiber. 8 glasses of water. Moisturize your feet every night. Small, consistent choices that compound over months. Here's the truth I want to leave you with.
Progressive damage can be interrupted. Irreversible damage cannot. The distance between those 2 words, an appointment you haven't made yet. Make it this week.
Think of one person, a parent, a sibling, a friend who has been explaining away changes in their feet. Share this with them before you close this tab, not because I asked you to, because you might be the reason they make the phone call that changes everything. I'm Chloe Lynn. Take care of those feet. I'll see you in the next one.